I remember that. Oh.
Yeah.
Okay.
Yeah. We'll get to it. Right.
So there will be what vultures do I have of my 6th grade?
Okay.
It's wonderful. We got a lot of last night.
Yeah.
Body is eating.
Angie, will she be able to respond?
Yeah, she.
Oh, good.
Anyway, it's just.
Yeah, I agree with you. It's just one more
Kids will be all
been a long day.
Virtual.
Yeah, we see them.
Hi, nice to see you again. Thank you.
All my.
Everybody else came 2008. Yeah.
I need to go.
Yeah.
President listed on 30, and I do have enough of them.
Okay, great.
Okay.
Well, we'll go ahead and call our meeting to order. And we have guests.
That our speaker.
Oh, okay, okay, yeah.
Hi.
Welcome. We're glad to have you.
And we also have with us a new board member, Ashley Hartman, and she's from Beaver Creek, and she will be replacing Andy Root. So if you'd just like to tell us a little bit about yourself.
Sure. My name's Ashley Hartman. I've lived in Beaver Creek for 15 years, grew up in Northwest Ohio. My husband works on the base. We have 2 kids, 13-year-old daughter, 10-year-old son. I am a social worker by trade, been for over 15 years. I've worked in nursing facility. I've also worked in community with Area Agency on Aging. And then right now I'm with Kettering Health, going on about 10 years in various roles. My current role with them is I work from home, and I work with the high utilization patients that can come back into the ER or into the hospital system to try to figure out what is going on, that what we can do to help manage them better. So that's what I do there. I'm trying to think what I have went to school at Bowling Green for my bachelor's, and I have 2 master's degrees through Indiana Wesleyan, my social work master's and master's in business. Really happy to be here with everyone and to work with a great organization that we would like to advocate for in our community.
Well, thank you and welcome.
Thank you.
If you have any questions, I'm sure anyone would be glad to answer those. No, we'll get my information. Okay.
All right, thank you.
Have you aboard. Okay, moving on. I need a motion and a second for the adoption of the consent agenda and the minutes of the last meeting.
Second.
All right. Is there any discussion or any changes, corrections, additions to the minutes or the agenda? Okay, all in favor, say aye. Opposed? Motion passes. We have a presentation on public health emergency preparedness by Kim Claudel. And she's our emergency response coordinator.
Hi, thank you very much for having me tonight. I'm here to talk to you about the Public Health Emergency Preparedness Grant. And so the goal of the Public Health Emergency Preparedness Grant, or FEP grant, is to build capacity, resilience, and response for any type of emergency. So it was basically a cooperative agreement that puts it's a critical source of funding for state and local public health. And it came from the CDC. It started in 2002, and it's to assist public health across the nation. So it helps health districts be able to respond to, prepare for any type of emergency or threat. And that could be anything like infectious disease, natural disasters, which we've had a few, biological, chemical, nuclear, radiological, or explosive events. Next. And we kind of follow the National Response Framework, and that is basically what guides the nation's response to any type of hazard, so that we're all working together and we're all on the same playing field, and we all know and understand how each other works. So the 5 key principles of that framework are engaged partnership, so that we're all working together, a tiered response. So if there's an event, we can scale it and basically decide how much of a response that event needs. We don't throw everything at the tiniest thing to begin with. So that way we're not wasting dollars. The responses are scalable, flexible, and adaptable based on what's going on. One of the big things is unity of effort through unified command. So that way the heads of each agency work together to decide on the response instead of each agency only doing what's best for their agency. We want to make sure we're all working together to do what's best for the entire public. And then readiness to act, to make sure we're all ready to respond to anything. Next. In 2011, the CDC established 15 capabilities that serve as the national standard for public health preparedness planning. So since then, these capability standards have served a vital framework for state and local preparedness programs to plan, operationalize, evaluate our ability to prepare for, respond to, and recover from emergencies. So I'm not going to read these in depth to you, but our 15 capabilities that we're working under are community preparedness, community recovery, emergency operation coordination, emergency public information and warning, fatality management, non-pharmaceutical interventions. Number 7 is the only one that is done at the state level. So locals, we don't do this one, and that is public health laboratory testing. So here in Ohio, that's the Ohio Department of Health Lab. Number 8 is public health surveillance and epidemiological investigation. Number 9 is responder safety and health. Then we have volunteer management, which here at Greene County Public Health, that's our Medical Reserve Corps. We take care of information sharing, mass care, and the last 3 are medical countermeasures and dispensing, medical material management and distribution, and medical surge. So for a quick snapshot on our funding, Ohio was to receive $11.5 million this year for the grant that always runs July through June. And with the president's budget, it was proposed $350 million for FEP, and that was a $385 million decrease from last year. The CDC basically took a 28% hit for the FEP grant. So the Ohio Department of Health was supposed to receive almost 8.3 million instead of the 11.5 million. Here at Greene County Public Health, we were supposed to receive $121,841 for a whole year grant that would end in June of next year, and with 19 deliverables required, which are a deliverable is like a project we have to do. Instead, we were awarded $87,726. They shortened the grant by 3 months, so the grant would end in March. And so basically we took a decrease of $34,115. So they did decrease the number of projects or deliverables that we had to do down to 11 to make it more manageable. But the good news is that Congress approved full flat funding for the FEP grant for the 25-26 year. So the Ohio Department of Health staff notified us on August 21st that they received word from the CDC on August 20th that the remaining balance would be issued. So the funds will be available in October. They will have to then issue us new deliverables or projects to do, and we will have to finish all of those by the end of June to meet the grant deliverables. We do not know what those additional projects are going to look like, until we have our meeting with them on September 16th. Some of the core activities funded by the FET program are planning and coordination. So we take care of the Emergency Operations Center here if things happen and we need to open up and start planning. Risk communication and multi-jurisdictional coordination. So a lot of times something crosses more than just our county. So we might have to work with Montgomery County or another county. We fund training and exercises. So we can do drills, tabletop functional or full-scale exercises, and we make sure that we have a ready workforce. For medical countermeasures and logistics, we just got done doing that for the last several years with COVID. That's stockpiling, things like the Strategic National Stockpile, which we received was gown, masks, gloves, medical supplies. Dispensing, which for that COVID, we did vaccines and all the supplies that came with that, and helping with medical surge capacity. And so one of the reasons, next slide, why it's so important to fund the FET program is because of the health outcomes and improvement and impact metrics, things that we're watching for, why this program is so important. It's to help with timely public health interventions and control measures, continuity of emergency operations during surges. So we do work closely with all of our partner agencies, and we usually have somebody up at the EMA or emergency management office that's a liaison between them and public health. We have rapid communication and situational awareness. So we'll put out situational updates to Greene County Public Health and all of our partner agencies. Efficient coordination with healthcare partners, so we can let the hospitals, nursing homes, and physicians' offices know what's going on and what they need to do. And then also early detection and investigation of incidents. So things like for the Beaver Creek tornado, we were out in the field walking the neighborhoods and asking the residents, what do you need and how can we help you? So there's a lot of important work in FET. With that being said, September is National Preparedness Month. So we want to remind you to build a kit, make a plan, and stay informed. So for Build a Kit, you want to make sure at a minimum you have 3 days worth of food and water for everybody in your household. The correct amount of water is 1 gallon per person per day. You want to get foods that don't require cooking. They're the easiest to deal with. Store non-perishable foods and store foods that don't require refrigeration. And believe it or not, you can get MREs and canned water that can last 10 years to 30 years. So not sure how edible they are as far as taste, but at least they're available. Some basic disaster life support items you want to have are a radio to stay informed, especially if the TV's out, flashlights and extra batteries. The new thing now is rechargeable batteries, and they're rechargeable flashlights, and they're awesome. First aid kit, because you can never find a Band-Aid when you need one. Whistle is the most important thing. If you're trapped in a building, you can only scream so long for help before your voice gives out. You can blow a whistle for a long, long time. It's much easier for everyone to hear and find you. Manual can opener, you forget you have canned goods, but you can't open them if you only have an electric can opener and you don't have power. Additional items are cash. People forget that if there's no power, there's no ATMs. If there's no power, your credit card readers don't work. And if you need to buy food or supplies, it's going to be cash. Copies of important documents like birth certificates, marriage licenses, insurance policies, bank informations, driver's license, social security card. You can keep those on a thumb drive, or you can always email them to yourself. So that if you have to check your email from another computer somewhere else, you can just pull up all those documents that you emailed yourself. Copies of prescriptions to make sure you can prove what you were on. Medications, so try to stockpile them. Each month, try to get your prescriptions filled a day early so that slowly over time, you'll have, hopefully a month's worth on top of your normal. And then don't forget pets. Make sure you have food and water and whatever you need for your pets. Preparedness on the road is the next slide. And you want to also have supplies in your car. You could be in an emergency trapped in your car. Things like a folding shovel, blanket, flashlight, ice scraper, hat, scarf, glove, cat litter to help get out if you're stuck, extra change of clothes and shoes in case you get wet or cold, hand warmer packets that you pop, candles, waterproof matches, don't forget food and water, and maps. A lot of times people forget if power's not working or the phones are down or GPS isn't working and you're somewhere away from home, do you know how to get where you're going? So paper maps is important and how to read a paper map. Second step is make a plan. So you want to make sure when you make your plan, you share it with your whole family. The whole family should have a copy and update it annually or when it's needed. Some things that you need to include in your plan are a meeting place. So like if your house catches on fire, you tell everybody, get out the closest exit and meet at the tree in the front yard. But now if it's a truck drove through your neighborhood and took out your house and a couple houses around you, or your tree's gone, maybe you need to meet at the church or school down the street. But now if a tornado comes through and those are all gone, now maybe you all need to meet at Walmart or Kroger's. So you need to have 3 places, super close, not too far, and then far enough away that if it's a big disaster, you still know where to meet your family. You need to have a communication plan, how to get a hold of everybody. And then the other thing is family medical information. If your loved one is unconscious, do you know all their medical conditions? You might, but do you know all the medications they're on, the doses, and who prescribed it? So that's something you want to make sure you know about everybody in your household. The next one is communication plan. So the biggest thing is if anybody's ever been to an event at the Nutter Center and you're trying to get online or make a phone call, it's not that the phones are down, it's that everybody's using it at the same time. So service is really, really bad. During an emergency, it's even worse. So the biggest thing is send a text. Because of the bandwidth, it's much easier. You have an 800 to 1 better chance of getting a text through than you do making a phone call. So make a really short text like, I am okay. And that's it. And then your family knows you're okay. Or a really quick one at Walmart, and they know you're okay and where you are. Don't try sending pictures or videos. It's just going to tie up the bandwidth and it'll never go through. You want to make sure that you have important phone numbers. Make sure you know local emergency numbers, work and school numbers. Another big thing is out-of-state contacts. Sometimes during an emergency, you can't make a call from Xenia to Xenia, but you might be able to make a call from Xenia to New York. So, or whatever state. And if you have a friend or relative in that state, you call them, tell them where you are, and then your family will call them and find out where you are. So it's great to have an out-of-state contact that can be the secretary for you to help reunite your family. And have paper copies. If your cell phone dies, do you know those phone numbers? We used to memorize them when they were landlines. Now we have them in our cell phone, and if our cell phone dies, we don't know anything. So make sure you have paper copies. And then the last step is be informed. Know what disasters can occur in your area. Find out how you will be notified if there's an emergency. So for those of you that aren't aware, in Greene County, we use the HyperReach system. So you can go onto the sheriff's website and find out how to sign up. And basically what it does is if there's an emergency in Greene County, it will text you. If you're on vacation in Florida and there's an emergency in Greene County, you're still going to get that text. They're going to text your phone number. Now, we worry about the people that are visiting our area that don't sign up because they don't know. We still need to notify them. So the sheriff's office has another system called iPause. And what that does is they can draw a grid on a map of Greene County, and they can do any shape, any size. So it can be a circle around Xenia. It can be a square around just the health department and hospital. Whatever area they choose, they can send a message to every single cell phone that's turned on in that area. So it's kind of like Amber Alerts. You didn't sign up for it, but you get it anyway. So that's another way if you don't have radio or TV. And then the last thing is when you find out emergency information, don't assume that your neighbors and family and friends know it. Make sure you call them and let them know too. And my very last slide for you is every year in Greene County, we do a threat and hazard identification and risk assessment called a THIRA. And so the top 5 things that we are planning for in Greene County are an infectious disease or outbreak, hazardous material incidents, which can be a chemical spill in a business, but it can also be some kind of hazmat incident on the road or with a train, since we have tons of highways and trains that go through our county. Number 3 is tornado or wind or severe storm. Number 4 is severe wind or cold, severe cold or heat. And then our last one is a large fire. So we've got a pipeline that goes through Greene County, and then also large facilities or forest fires. With that, does anybody have any questions? I know that's a lot of information. Yes.
What other agencies do you work with personally? You like go to the LPCs or?
I do go, I'm the secretary for the Greene County LEPC. So I do go to that meeting. We have MMRS, which is out of Dayton, and that's we have a committee called the Mumbai Committee, and that basically deals with things like terrorism. When we keep getting the swatting calls at schools or hotels for police presence, where someone will call and say there's a big event and they need the SWAT team. So we learn a lot about workplace violence in that group as well. So things to watch out for. I'm on the meeting, which is called the Healthcare Preparedness Coalition. So that is where the local health departments work with the hospitals so that we can practice together, drill together, exercise together. That's just to name a few. There's several. So we do work very closely with Greene County Emergency Management. And then I'm also on the Emergency Management Agency's board. So I do go to those meetings once a quarter. So we do all play very well together with fire, police, EMS, sheriff's office. And when we do have a meeting here once a quarter called the Greene County Emergency Preparedness Committee. And so I am the chair of that. And we have a lot of the nursing homes and long-term care facilities that come to that, as well as fire, police, Green Cats, TCN, Access Center for Independent Living. So we all work together again, and we give them the opportunity to learn from us on how to write emergency response plans, how to drill, and how to be ready for emergencies. We are very active. Anything else? All right, well, thank you so much for having me.
Thank you. I'm still getting used to people being remote. We have Angie that's with us. And then also Dr. Palicadetti, but I think he's on a different.
He's on a general.
He's on the general, so he can't respond to us, but Angie can. So if you have any questions or anything, please speak up. Next we have the finance report.
Sure. So we are 67% through the year. So tonight we'll be looking at August in review. So the way we look at this report is the revenue is up at the top and the expenses are down at the bottom. And then over to the bottom right-hand corner, you'll have some financial health indicators. So up in the revenue section, again, I said we're 67% through the year. We can use that as a loose target for where we would want revenue to be, given that a lot of our revenue is very seasonal. You could use straight calendar metric to determine that target, but you can use that as a loose metric. So we typically look at the funds that will bring in and account for the largest majority of our revenue, and then you can just kind of work your way down from that. But the general fund always counts for the largest portion of our revenue. That's where our tax dollars come in, our property tax dollars. So you can see that that is estimated to be just about half of our revenue. So we always look there and see how that fund is performing. Right now, it's up 2% from this point in the year last year, and it's already brought in 4% over what we anticipated for the whole year. So it's at 104%. So that's good. It looks odd if you were to look at the 2 years of comparison data, because I explained this last month. Last year, they deposited the apportionment in July. It usually always gets deposited in August. So we flip-flopped last year, so you get this weird comparison to August 2024 to August 2025. So just to point that out, but you can see the cumulative number is right on with where you would expect. Then our second largest fund is 0037. It's the third one from the top. And right now it's at 77% collected for the year. So that's over that 67%. And then just the rest of them make up our total revenue. So they're much smaller percentages, and you can look at that and just see where it corresponds to that 67%. And that's how we get, so far for this year, we're at 93% of our total anticipated revenue collected. When we go down to expenses, that one you can use that 67% with a little bit more confidence because payroll drives our largest expenditure. And that's every month. So it's really reoccurring and regular. So we can use that for a little bit more accuracy. So we want to be at 67% or less expended. Again, the general fund accounts for our largest portion of our expenses. So it's anticipated to be about a third of our expenses. So we would look at that first, and it's at 65% of its estimated expenditure. So we're right on track with that 67%. And then our next largest fund would be 0037, which is again third from the top, and it's at 62%. So again, that's under that 67% target. And then the rest of them kind of follow suit after that. Overall for the year, we're at 62% of our total estimated expenditures. So we're underneath that 67% target. So revenue and expenses look good. If you were to go over to that bottom kind of table on the right-hand side, we would look at how efficient these funds are performing. So that's what that operating ratio is, which is the second column from the end, from the far right. And the target there is 100% or less. That means if it's at 100%, the revenue is covering its expenditures. If it's over, then the revenue is not covering the expenditures in the fund. So it'd be operating less efficient. So you can see we have a handful that are over that 100%. Those are the ones largely that are either grants or funds that have grants in them. And those are very seasonal, you could say, or non-reoccurring similar amounts that based on when we meet deliverables, the amount may be 10,000 this month and maybe 5,000 next and maybe 20 the next. So timing plays an integral role in that, but you still always have that personnel expenditure. And then for the other ones, they're reimbursement based. So we have to spend the money first before we get reimbursed. So timing plays a role in those as well. Also, when we switch over fiscal year, state fiscal year, ODH is not responsible for paying up to 60 days to reimburse us. So we can get delayed in our money coming in, and that can mess with the numbers a little bit too. So just a little context for those. But overall, we're at 78%. So the organization itself is operating very efficiently. So any questions over the income expenditure report?
I have a question. Sure. The cash balances, I know last year we had to put some money in the funds. And so this year it looks like that, if I'm reading that right, it's at 14 million.
Yeah, that's year to date. Yep.
Year to date, says the auditor going to be asking to put more funds into like fund balances.
So the one that we care the most about is the general fund, and that's the one the auditor was specifically looking at. And this year we've driven it completely down to within the parameters of our goal. And we haven't even done our final transfers for this year. So we should be right at that 1-to-1 ratio that they would prefer. So I think we'll be in a lot better shape.
Okay, thank you.
Any more questions? Cool. So the next report is on this golden paper. And this is the voucher summary, or what you could consider just the expenses for the month. So usually it just give everyone a handful of minutes to lead through it, and you just get to see the detail of the expenditures. If you have any questions, you can just ask and I can try and answer it.
Garage door.
Oh, the garage door was just aging and it was time. Nobody had paid for it. Yeah, it's just part of that maintenance that we've been doing these last couple of years to the building when things are just now getting to the point where they're starting to need replaced.
I noticed the parking lot.
Oh,
Yeah.
good.
What did you think?
Yeah, I mean, I noticed that it was that it was sealed and striped, but I didn't like pay attention to fine detail. But I noticed, but I did notice that it was significantly darker and easier to see the stripes.
Easier to see the stripes. Yeah. Are there any other questions about the voucher summary?
What is the second half settlement 2025 for?
That is the cut the auditor's office takes from our tax apportionment. They take 1% of whatever we bring in. You could consider it their administrative fee. Any other questions? Moving on. Last report you have is on the salmon colored sheet of paper, and these are just the appropriation transfers. So this is when we move money between lines within a fund to pay for an expense. Or sometimes we'll have to pull from unappropriated to take out of the fund's cash balance and put it in a line so that we can use it. So every time we move money, it shows up on this sheet of paper. Nothing really outside of operating here. The largest one on there is that 15,000, and it's attributed to the parking lot.
Has the title always been there, Board of Health then and now on the top?
Oh, we added that maybe 3 years ago now, from audit recommendation. It's just so we can include the then and nows down there at the bottom as well. But we didn't have any this month, which is a good thing.
I've noticed that before.
Yeah, I think it's going on 3 years now. Any questions over any appropriation transfers? That's all I got.
Thank you very much. We need a motion and a second. The monthly income and expenditure report, the voucher summary, and the transfers between the funds. Appropriation.
So move.
Yeah.
Second.
Thank you. Any questions? All in favor, say aye.
Aye.
Opposed? Okay, they are approved. We'll move on to our committee reports. And for governance committee, Nancy's not here tonight, but we did not meet. And performance evaluation committee, Bill's not here either, but we did not meet for that committee. And planning and finance committee. I just want to say that Andy will be leaving the board because he's no longer resident or works in Greene County. He's in Montgomery County now. So he'll be leaving us and have Ashley to take his place. So we sure appreciate all that Andy's done for us. My gosh, it's been on for a long time and really done a lot, held a lot of positions on the board, and really appreciate everything that he's done, and we'll miss him a lot. And Marty has agreed to chair the committee since he's the chair. Andy was the chair of the Planning and Finance Committee. Marty's agreed to take over for that for this year. So we appreciate that.
Yeah, sure.
Okay, so we'll move on to new business. And we have the 2026 proposed environmental health fee for the first reading. And do you want to say anything about that?
Oh, you want me to read them all?
No.
Oh.
Have you have any comments or?
No, there was an incremental adjustment to our fee prices as we usually do each year. This time it was pretty much across the board. A few things remain unchanged. I have the benefit with association with my fellow EH directors and health commissioners to take a look at adjacent counties, especially those our size, and make sure that our fees are in the same ballpark as they are. And they are, generally speaking. The differences might be between a county like Clinton perhaps, or Dark or Clark. Those are all a little different, but pardon me, but for equivalent counties like Delaware or Dayton, we're right there.
Cedric, can you explain a little bit about cost methodology and how you arrive at a maximum fee?
Excellent. Yeah, sure can. So let's start with the food program. The law dictates that fees must be calculated through a certain process called cost methodology. Essentially, that's a way of taking a look at all the expenses in salary, benefits, equipment, office supplies, everything that goes into a program that's credited to that program, and then the fees are based on that, so that essentially the public is getting a one-for-one. Is that a good way to describe it? Basically, the fees are covering the program exactly. We are forbidden from making a profit. So if I were to propose a fee of, say, $500 for a level 1, well, that would generate more money than we expend in that program, and that would be illegal technically. So we have a spreadsheet that we use that's provided by the Ohio Department of Health and the Ohio Department of Agriculture for the food program. We put all our numbers in there for each of our sanitarians, administrators, et cetera. And it kicks out a maximum fee, the most we could charge before we get into that profit territory, basically. We then look at the fee we're currently charging and can propose a fee in between the maximum and what it takes to actually run the program. When that's all done, the cost methodology is actually forwarded to both of those agencies, and they take a look at the nuts and bolts of my calculations to make sure it's reasonable. And they do a great job. They are not finance people by nature, but they really go through it with a fine-tooth comb. So when I get their okay back, I have confidence that my numbers are really good and that we're being fair. For the other programs, it's interesting. The law indicates that those other fees shall be based upon a cost methodology, but not one exactly prescribed by ODH or the agency that's regulating them. So what we do then is use a sort of adaptation of the food cost methodology spreadsheet and apply it to the other programs. So the same principle is the same. We're not making money on the state mandated programs there. We're taking only what we need to keep the programs going. Now, all that being said, you can see that my maximum fee is largely well above what our proposed fees are, especially this year. We would always be careful to approach that maximum fee. Traditionally here, our fees account for about 2/3 of our programs in environmental. So that's where we try to keep that about 2/3. The other 1/3 comes from general funds. Anything else? Anything else?
So what's that, the proposed is to be determined, the then license?
That's a good one. So that's yet another exception to the rule. Actually, the law says that vending licenses shall be based upon the consumer price index that only comes to us the second or third week of January.
You have to wait for that.
That's what I have to do
For doing it, okay.
by law, yeah.
Okay, thanks.
Cedric,
Yes, sir.
what is driving on the new well permits and the septic site reviews and permits? What's driving that fairly big increase of over $100 on some of those?
Good question. First, let's take it with multiple reasons. First, the water. Whenever a person bought a well permit here, we would charge a permit fee. And then the law requires that a sample be taken from that location. So then we would additionally charge a water sample fee. What I have done in this case is make a modest increase in the actual permit fee and roll in the sample fee. So what you're really seeing, for instance, new well permit residential, it was $248. It was $248, but then it was also $100 plus another $64 for the water sample. So what I've done now is instead of it being $348 all rolled in together, I increased it $52 to give us a $400 permit fee, okay, which would include the cost of running out there and doing the sample too. The other increases, though, are directly related to the time we're now spending in the field. Our additional 5 hours. Once the economy rebounded, it came out of COVID a little bit. We started getting more sewage permits, sewage septic designs. There's always a lag, so the cost methodology is done on what happened the year before for the year after. So in 2025, we're looking at what happened in 2024 to set a price for 2026. That's why you're seeing that increase. At the end of the year, we put a lot more time in because we had a lot more permits coming in. So,
Thank you.
Other questions? Thank you very much.
sure.
Okay, so this is just the first look. And you'll be back next month, right?
Yeah, so for the board's knowledge, now I'm required that the first reading has been done to issue to all interested parties a letter. So all food establishments tomorrow morning will be mailing out letters so they know what changes are coming, so they would have the opportunity to comment for the board's rules at subsequent readings. Okay, so everybody knows what's
Do you
happening.
specifically tailor those letters to the different, like for the well permits? Are you gonna, do the people that, the well drillers, they get a letter that says now that lab fee is included, or what?
Yeah, I'll probably need to, I'm glad you mentioned that because I haven't custom written that letter. We use kind of a standard letter for most of them.
Okay.
But I'm glad you mentioned that. I'll fix it. Yes, I will tell them. Primarily we're concerned with food establishments, right? Because they are the biggest driver of our funding here. So they'll get letters almost immediately. Same thing for swimming pools, for body art, anybody that has an annual permit that gets renewed. Building and construction is a little different. But the contractors will get, we don't know who's going to buy a septic permit, but we do know who the contractors are. So we'll send those two parties a letter and explain what the changes will be.
So next month is the public hearing. And so for any letters or comments that we receive back, we bring that to the hearing, and that's when the public is invited to come to the meeting and make comments as well. But you're not adopting the fees until the third reading.
Thank you.
Yeah, sure.
Okay, next we have a resolution of appreciation for Andy Root. And I'll go ahead and read that. The Greene County Board of Health wishes to recognize and commend J. Andrew Root for his leadership and service to the Greene County Board of Health, Greene County Public Health, and Greene County community. Whereas the city of Beaver Creek appointed Mr. Root as representative to the Greene County Board of Health effective December 8, 2014. And whereas during his tenure with the board, Mr. Root served as board president in 2018, 2019, and 2021, and was elected as vice president in 2017 and 2020. During his tenure with the board, Mr. Root presided over the Planning and Finance Committee and nominating committees. And whereas Mr. Root's leadership of the Greene County Board of Health as president and loyalty to the Greene County community during his service with Greene County Public Health and the Greene County Board of Health have provided an incredible example of public service. So be it resolved by the Greene County Board of Health. Section 1, the Greene County Board of Health wishes to express its appreciation for Mr. Root's 10 years of service on behalf of the Greene County community and Greene County Public Health. Section 2, that a copy of this resolution be presented to Mr. Root as a token of the Greene County Board of Health's appreciation for his faithful, dedicated service. So I move for approval of this resolution.
So moved.
Thank you. And all in favor, say aye.
Aye.
Opposed? Okay. Let me sure thank Andy for all that he's done for them. He'll really be missed. Next thing I have is just an additional thing. We're getting towards the end of the year. I know it's just September, but we need to elect new officers in December. And Sylvia is our vice president, so she will step into the president job. But we need to have a vice president to fill her position. So we need a nomination committee. So if like maybe two or three of you would be willing to serve on that, I would appreciate it if you could just let me know if you want to do that. Appreciate that. We just want to get that process going so that by the end of the year, we have all that done and ready for 2020. And thank you, Sylvia, for vice president. Additional business, there is a carry-in, Greene County Public Health carry-in and employee meeting that will take place on Thursday, September 11th at 11:30, and everyone is invited to attend that. And I don't know if anybody else has anything they'd like to share, or Angie, if you have anything.
Congratulations on getting the FAB letter. And it's a lot of-
So we found
lot
out
of work.
today
Yeah.
that we've received reaccreditation for 5 years, so this is our second time for accreditation. We have one measure that we have to address in our annual report next year.
Oh, that's outstanding. Well, congratulations
Yes.
to everybody for that. I know a lot of hard work went into that. Sure.
I think anybody who's ever been through
Yeah.
any accreditation.
Oh, yeah.
How incredibly difficult it is. So.
Well, congratulations and job well done.
So
I
the
just-
upcoming SHAW meeting, is that, I know that's part of the accreditation.
It is,
So
so.
you're just already starting for the next cycle or?
Yes.
Okay.
We're doing
Yeah, right.
Never stop.
Never stop.
Yes, our existing child chip strategic plan process, the strategic plan will end in 2026. So between now and December of next year, we have to do the CHOP with large surveys to the community, and then we do the CHIP where partners come together and select the most important health issues in Greene County. And they write the CHIP, the Community Health Improvement Plan, and who'll be working on what. And then we also do our strategic plan following those two things that are more specific to the health district. So it is so much fun. Keeps us on track, helps us communicate about just exactly what we are doing and gives you measurable outcomes. So it's fantastic. I would just add, I know that Dr. Sherritt's not here tonight. He's vacationing. And he would probably tell you that right after allergy season is respiratory season. And so, gearing up for flu, COVID, RSV, and we expect those to be going up. And I would also just want to mention that we are on the ballot this year. We're going to be issue 1 on the ballot. So we have a renewal 5-year 0.8 mil operating levy, and that is about $18 for every $100,000 of property valuation. We're probably the smallest levy of all of them.
Anything else?
No, I don't have anything else. Thank you.
Anybody else have anything? Angie, anything?
I do not,
Okay.
because I have been in attendance the entire time.
Thank you for being on. Okay, our next meeting will be October 2nd. I don't have anything else, so I guess we can go ahead with you. Thank you for coming. Have a good rest of the month.
Miss Ashley, thank you so much for joining us.
Yeah.
Good to see you.
Thank you. Better write down.